Bariatric surgery is indicated for patients who are overweight and obese. And the idea is that, much like cardiac surgery, where you bypass an occlusion, in bariatric surgery, you bypass the stomach and the proximal gut where metabolism happens. And that means that you move the food nutrition further down your GI tract, and that allows the metabolic indicators to change. Now, why is that important? About 70% of people who are overweight or obese also have type 2 diabetes. So what we know from surgery is, when comparing it to medical therapy over a 12-year follow-up, that patients that were on medications for diabetes, including insulin, come off their medications in 50% of all patients. So bariatric surgery is really the gold standard for treating obesity and for type 2 diabetes. So what is the mechanism of action here? The mechanism of action is been validated now in numerous clinical studies and thousands of patients for bariatric surgery. That said, most people don't want to have surgery. As you can imagine, it's very invasive, and only 1% to 2% of all patients who qualify for bariatric surgery actually have the surgery. So the vision of our company was, could we deliver a daily oral therapy that replicates the benefits of surgery? And that we've demonstrated in animals, and we've trademarked surgery in a pill. So our drug LuCI has a patent as a new formulation of a very well-known and safe drug called sucralfate. Sucralfate has been prescribed now by primary care physicians for over 38 years. It's indicated for use in the stomach and the intestine, but for a different indication, which is ulcers. And ulcers are irritated or injured mucosa, and sucralfate today is delivered either as an oral or a tablet, which adheres to that area to protect it so that it can heal. What's novel about what we've done with sucralfate is we've changed the formulation and manufacturing, so now it actually is rendered pH-free, and instead of attaching to ulcerated tissue, attaches to all mucosa. So you could think of it as basically a luminal barrier. So you take a LuCI before a meal, and instantly it turns into a paste, which is delivered in the stomach, just like gastric bypass, and then moves through the small intestine. And it means that when you eat, the food is now moved out further in your intestine, and it gives the body a chance to reset, and it's shown in animals to reduce glucose and reduce weight. We heard about Bioniques in the April-May time period when they reached out to us and said, "Are you interested in doing partnering or potentially even out licensing?" And we felt that it was a very interesting platform because it has a combination of both investors as well as pharma and biotech companies. So we joined the platform so that we could get exposure for LuCI AJN 003 and possibly find a good partner or collaborator here.